Good evening, Teacher
Welcome
Zita.
back to the show once again.
Thank you.
Everybody's excited and waiting
Me
to
too.
listen to this discussion.
Me too.
Say hello to the viewer.
Yes, good evening, viewers.
Okay, thank you so much. Doctor, not to take a lot of time,
Yeah.
today as you can look at Medical Minds, we are going to look at infertility. Yes, infertility, something that everybody has been waiting for. They want to hear what causes it, what are the treatments, why is it so common these days. But before we go into details, Kylie, in your own word, as a medical personnel, describe what infertility is.
Yeah, it's a very good starting question because we have to understand what we are talking about. So we talk about infertility when a couple, that's a man and a woman, have been trying to conceive and they are failing to conceive in 12 complete months. That means
that is 1 full year.
1 full year. That means they have been trying, which means they are staying together, they are having sexual intercourse on a regular basis. Regularity is defined as at least 3 times in a week.
Okay.
So if we verify all those situations and after 1 full year of trying, and they are not using family planning,
True.
they are not yet able to conceive, then we say they have infertility. Remember, I'm talking about a couple.
A couple
Yes.
living and staying together.
Yes, so infertility should be defined for a couple, not for one person.
Okay.
Yes.
Thank you so much, Doctor. In your own words, so infertility in brief is the ability to fail to reproduce.
Yes, the inability to get a pregnancy in a period of 1 year of trial when they are not using any family planning methods.
Thank you so much,
Yep.
Doctor. Let's look at it in this way. Where does the infertility rate lies mostly? Is it in men or women?
Yes. So surprisingly, when we will be discussing about the causes, these are distributed equally in both sexes. We'll be discussing that. It is, I think, the influence of our culture to have us perceive that infertility is more in women than in men.
Okay.
That's not completely true. That's not completely true.
Okay.
Yeah. So, and in our population, we actually have a very high prevalence of infertility. The evidence we have from the preliminary assessments is that nearly about maybe 20 or 30% of our population suffers delay to conceive or delay to achieve a pregnancy in some way.
Okay.
So, which is about 2 to 3 couples out of 10. So, if you move on a particular day and you attended like 10 wedding parties, yes, about 2 or 3 of those couples will be having challenges of conceiving in the next 1 year.
I understand.
Yes.
What could be the possible causes of infertility, especially in young couples? At least we know when someone is grown, their years have gone, but in the young generation, what could be the common factors actually, the common causes contributing towards infertility?
So when we assess couples who come to visit us with infertility, we actually find out that in about 30% of them, the problem is a tube problem.
Tube, that is in women? In
women.
Okay.
So in about 30% of the cases, it is the tubes which are usually blocked. And in about another 30%, the problem is the sperms. There's a problem with the sperms. Either sperms are too few or they have some abnormality. And then another about 10%, the problem is in both the sperm and the tubes have issues. Yes. And in some cases, we find the issue is the womb. The womb, for some reason, either is scarred or has some issues which makes the pregnancy not to be sustainable.
Okay.
Yes, but in some percentage, like about 10%, we find you can't find a reason. you do all the tests and everything is normal, yes. So we say it's unexplained.
Okay. Doctor, before we go so far, what causes those blocked tubes in women especially, the scars and because at times someone says I have blocked tubes.
Blockage of tubes. In our population, the commonest cause is usually infections. The commonest causes are usually infections.
What type of infections are those?
Infections into the tubes come commonly because of miscarriages, abortions. People have pregnancies which they don't want, and then they go ahead and they remove their pregnancy. And then they get infections after that.
Okay.
Lately, we are beginning to see some cases of endometriosis causing blockage of tubes. Also, that is one of the causes. But also, some people still get STDs in our population. We still have gonorrhea, we have still chlamydia in our population.
So, STDs cause blockages of tubes, even after treating?
Yeah, because most cases of STDs, for some reason, people present late.
Oh,
yeah, they present late.
By the time they're discovering it has
yes, it has already caused some damages. Because you see, sexual transmitted diseases, they have some bit of stigma. People don't openly come out,
True.
And so it shows that maybe they have had some sexual issues, and then they are coming up with this infection, and so they delay to come for treatment. Yeah.
I understand. Let's talk about the low sperm count.
Yes.
Especially in men. What causes that?
The low sperm count. Yeah, so the low sperm count, as I told you, in our population, about among our couple who come for treatment, about 30% of them have issues with sperm. Yes. Now, the low sperm count, in some cases, we're able to identify the cause, the underlying cause. In some cases, we're not able to identify. We just look at risk factors. But common things which show up is that some men have had viral infections in early childhood.
Okay.
Yeah, there are some viruses which destroy the testes.
When a child is still young.
Yes, so commonest to be mentioned is mumps, and that's why it was a very good idea to really promote vaccination against mumps. It's now among the things we vaccinate against. But people used to get a lot of mumps. It is a mild infection, but later in future, it shows as low sperm count because the viruses go and destroy the sperms.
That is in the male child?
In the male child.
Do we have an illustration for us to see a few things that you're talking about, especially the tubes?
Yes, so if we, maybe now since we're talking about the sperm count, so to confirm that somebody has a low sperm count, usually we have to examine in the hospital. We have to examine their sperms, and so we have the laboratory person will show us that the sperm count is low, and you will see something similar to this actually. Yeah, these are nice. Okay, so over here, this is how a normal population of the sperms will be like. I hope it appears. So you find them crowded, and usually when they give the report, it's about 15 million or so.
That is released during the...
Yeah, so they get the fluid which the man releases and they analyze. And they find the density of the sperms, that is the concentration of the sperms. They count the sperms per mil, and that's what we usually report. So about 15 million per mil is normal. And on the image in the microscope, this is how it appears.
Okay.
But on the other side, you find people have few sperms. This is how it will appear. They will be spread all out, and it will be obvious.
Okay.
So now when the sperms are few, for pregnancy to occur, these sperms have to travel a long journey. They have to go all the way from cervix to the uterus, and then to meet the egg in the tube. It's a long journey, and on the way we lose a lot of the sperms. And so you need many to be able to have a few reach the site of fertilization. Otherwise, if you start with a few like this, none will reach the other side. Many perish on the way. Okay. So it's important, the sperm count for us. Other parameters related to the sperm also are examined. For example, the sperms have to have a certain shape of the head, the tail, for it to move in that journey. All that is examined. So the problem could be in the sperm.
Okay.
Yep.
Thank you so much, Doctor.
Yeah.
I wanted kindly to have a small illustration of the blocked tubes so that we see exactly.
Okay, the tubal problem.
Yes, the tubal problem,
Yes.
where it lies, which side is always blocked.
So maybe we look at, so to test the tube, the commonest test is what we call hysterosalpingogram. Now, this is an X-ray test specifically meant for the tube. So what happens is the tubes and the uterus, they don't have bones, so the X-ray cannot see them.
Okay.
And so for the X-ray to see them very well, we must put in some contrast. So we put in liquid which the X-ray can see through the cervix, through the womb, and it flows into the tubes. And then we take images. Now those images are read by the doctor, and then he's able to interpret. Okay. So maybe we can first look at the normal one.
The normal,
yes, the normal tube.
Let's
have the image for the normal tube. Yes, so here it is. Yes, so when the contrast is pushed in, it flows. This white stuff you're seeing here is the contrast medium which is flowing into the uterus, and then spills over through the tubes, and then you find it pouring free. You find it coming out, which means here the womb is open. Otherwise, the womb will not allow this to pass through. Means the tubes are open. That's why they are filling up. And that means they're open right at the end, so that's why it's pouring out. So this is how the normal one looks like. You can go through this womb, then you see the tubes appearing like a thread, and then you see things pouring out like water out here. This is a normal one. Now, on the other hand, if you compare with the abnormal one, let's have a look at it. Now, you see here, this is down. Look at this. This is the uterus now. One of the tubes is beginning to appear, and it has some nodes though, but it stops right here, completely different from what was in the other one. Something is showing up here, it stops just here. So you don't have the other parts of the tube showing.
Part flowing down.
Yes, so all this part is not showing. So this is tubes blocked on both sides, what they call the bilateral blockage of the tube. So this person definitely has a problem with the tube.
With her tubes.
Yes.
So it becomes very hard for her to conceive.
Yes, because for you to conceive, the sperm has to pass through here and swim out through here and meet the egg around here. So that fertilization occurs, and then the baby, after fertilization, we call it embryo, has to be brought back and attaches in the womb.
Settles in the middle.
So all this movement requires the passage to be open. But also the tube should have the mechanism which helps to move those things.
Helps the things
should
to
be
move
working.
and allow them.
So some of those mechanisms are the ones which sometimes, in some cases where the tubes are open on this test, you find somebody can still not conceive. And yet there's an issue with the tube. That in such a case, the problem is that the infection, for example, chlamydia, it destroys the small tiny hairs which beat to move the egg. The egg does not have its tail. It's unlike the sperm. The sperm has a tail. The egg has no tail. So it has to be moved by that, like how food goes through the intestine. So if that mechanism is destroyed by infection like chlamydia,
the egg does not move at all. Thanks so much, Doctor.
That's why even in situations, some people ask this question that they have done all the tests on me, my tubes are open, I'm normal, but things are not conceiving. You find that is sometimes the case.
That thing is missing, that you have to push.
Yes, and that is difficult to usually test. But now, currently, there are some tests showing up which are
moving around. Thanks so much, Doctor, for that very wonderful illustration.
Thank you.
Just in case you've just joined us, this is Medical Mind, and it's Bethany TV. We are talking about the basics of infertility. To all the parents outside there watching, I had a doctor talking about mumps. We need to take mumps. Was it mumps, Doctor?
Yes,
mumps. We should take it very, very seriously, because in the end, at times we just give children these herbals. We say it is just an infection, maybe it's fever. We give them Panadol, little knowing that the infection can really, really disturb the child in future. So we need to be very keen. And then to the ladies outside there, infections, if you are sick or you've contracted an STI, please don't wait when it's too long. You know, the effect can be so diverse that it affects you in the future, and it becomes very hard for you to control it. Thanks so much, Doctor, for that excellent explanation. Now, let's look at the African traditional society long ago,
Yes.
versus today's modern world.
Yes.
Back in the days, there were very few cases of infertility, unlike these days. Could there be something triggering it out? Could it be the feeding? Could it be the environment? I don't know. What could be the cause of this?
So it's a mix of things, because first of all, the question is it true that there are more cases of infertility now than compared to in the previous seasons? The answer is yes and no, because initially we didn't have very good
medical
tests, and so many of these cases were going around without being noticed, and many people were not showing up for your tests, because most people would prefer to go for traditional checkups and those things, and people had their traditional solutions.
Traditional ways of handling their own life.
So you find a man, this lady is not getting pregnant, he gets another one like that. But it seems that if you look at it, also it may be true on the other hand, because now the social structure, the people's social lives are changing. Women are delaying to conceive. This is the thing. Initially, people used to get married at 18, 20 years of age.
And they give birth immediately.
Yes. So now we are on average, first birth is coming at 30 and 32. That's almost in the evening.
The evening days of our life.
Yeah, so that delay is significant, because along the way you get other problems. So it could be a mixture of things and a number of variables there. People are getting more aware, so they are going for treatment, but also people are delaying to conceive, and that has an impact on their fertility as well, especially for the ladies. Yeah.
So how about in the men?
In the men, yes. So in the men also a number of things are changing as well. We talked about mumps infection as one of the causes of male infertility, things which can disturb the sperm. But also lifestyle is a very big factor. A number of men are going on recreational medication for recreational purposes. And in our population, you will be surprised, a number of these men who look very masculine and doing a lot of aerobics, some of them are taking medications which do affect their fertility. You find they are on testosterone-containing medication, which enhances their male masculinity. Their masculinity is enhanced, but it drops their sperm count on the contrary. And so they don't they may be sexually okay, active, but the sperms are few and they're not functioning well. Yeah. So recreational medication, even smoking. Smoking is
basically drug.
Yes.
Drug use.
Yeah. Smoking and alcohol. All these things are affecting. Yes. Of course, men are delaying as well to marry and have babies. For the men, the issue of the sperm count dropping in relation to their age comes a bit later, in their late 70s.
Yeah, sure.
Yeah, so, but their behavior, the social behaviors, alcohol consumption, smoking, recreational drugs. Recently, people are beginning to take shisha, and the shisha has many of those things in there. So that might be another thing to look at. Yep.
I understand. Thank you so much. So how does a man know that they have low sperm count?
Oh yes. So again, you can't tell it from the outside. You have to analyze the semen. That fluid which the man releases at ejaculation has to be analyzed in the lab to see the density of the sperms, to see the structure of the sperms, to see how the sperms are moving, and we can do some extra tests to assess the ability of those sperms to fertilize.
Okay.
So that has to be done in the hospital.
Okay.
But you can look at telltale evidence in yourself to see if there could be some problem. For example, if your testicle size is reduced, you can palpate in the scrotum and see that the testicles are smaller, or maybe they are softer by yourself, or they are painful when you touch. So those are signs.
Those are small indicators.
Yes, small indicators. Some people, their testes never descended. You know, by design, our testes are formed from inside the abdomen.
Okay.
And then they move out and enter the scrotum. So in an adult, you find the testes, the normal position should be in the scrotum. But you find in some people, the testes are not there in the scrotum because they got trapped on the way.
Okay.
Yes, what we call undescended testes.
Okay.
And so it's important for the parents to examine their male children
When they're still young.
when they are still very young, very, very early.
Okay.
But also it's important for the health workers who look after these children. When the child comes for pneummonia or malaria, you examine the whole child.
The whole body.
The whole body.
You don't only take a test for malaria.
Just don't do that. Don't care for the child on a pain. Just, okay, mother, what's the problem? You just write test. No. You have to examine this baby because you might be the savior of this baby's future.
Thank you so much.
Yep.
We are talking about infertility, and doctor is trying to explain to us into details the common factors that causes a lot of infertility among men and women, and then also into the young little children. Doctor is still talking about you being very keen, especially the caretakers of the children. Check the child where possible. You can be part of us in the next coming minutes by sending your messages on WhatsApp on 0786 050 762, and the doctor will be able to reply you and respond back to your queries. You can as well give us a call when that time comes. We are still talking about infertility, and it is Medical Mind. Doctor, what are there some examinations that someone can take to find out if they have blocked tubes, or to find out if they can't function well, or if they are infertile?
Yeah, so usually when a couple has an issue with the conceiving, the first thing is we have to identify the underlying cause. This is a must before even you give any treatment.
Okay.
Now, for pregnancy to occur, at the basics, 4 things must be in order.
Okay.
1, there must be sperms. 2, there must be eggs. 3, the tubes must be open because the sperm and the egg meet in the tube, as I illustrated. And finally, the womb must be fine. So these 4 things must be okay and working well. So if a couple has any issue with conceiving and they're not getting a pregnancy, those questions must be answered. So these questions are answered through tests. Yes. So 1, how do we know that the eggs are okay? For the woman, to know that for us to know that the woman's eggs are okay, 1, you look at her age, because this is one of the commonest factors. If you see the woman is within the productive age, that's a tick. But then you look at... The
productive age is 18 to...
Oh yes, that's good. Within the age of 18, actually from as low as 15, but between 18, between 18 to 35, that will still be considered a good age.
Okay.
Yes, but then also her periods, you have to see if the periods are coming regularly, and she's not missing a period, that's a good thing. But you must confirm the situation of the egg with hormones.
Okay.
There are specific hormones which tell you that, yes, the eggs are enough and they are of good quality.
Okay.
Yes, we do those hormone tests. So that is for the egg. Then for the tube, the most used test is what we call the HSG. It is the X-ray test for the tube. That X-ray test for the tube, which we saw on the images, it will show you what the normal tube is like. It will show you what the abnormal tube is like.
Okay.
Now, for the womb, the examination of the womb needs a scan,
Okay.
an ultrasound scan. There are different problems of the womb which may show up, and so it will be seen on the scan. Okay, the ultrasound scan, we can see a normal ultrasound scan image. Let's have a look at it.
Okay.
This is just the structure for the womb.
Okay.
Can we have the one for the scan, normal ultrasound scan for the womb? Normal scan. Yes. So when we do the scan, this is how a normal womb will look like.
Okay.
Nice. This is the muscle and this is the lining inside. So this is how it will look like. Very simple to see. Even the doctor can show you when they are doing the scan. Yes. For example, some abdominal cysts can be like the fibroids. Maybe we can have a picture of the fibroids. And oh yes, I hope this is a little bit is clear. Yes, I think so. So if you see the difference, the previous one was nice.
So
it was
clear.
all looking like that.
Yes.
But now we have a ball here. This is a ball.
That is a cyst. Is it a cyst?
No, this is a fibroid.
A fibroid
Yes,
that has developed
within.
in the womb.
Yes. So such may be
Okay.
one of the problems with the womb. Yes. So this is what the scan shows you. And by just this simple test, which is available almost everywhere, you're able to tell that the womb has a problem or it has no problems. And in some centers like ours, we're able to evaluate this further and see the relationship between this fibroid and the cavity of the inside. So we have some additional modification of this test. What we call the sonohysterogram, where we put in some fluid and you're able to see the edges very well, and you know, oh yeah, this is the, and even it's not magic, the patient can see it for themselves. So this is how you assess the womb.
Okay.
Yes.
Okay.
Yeah, and then
so
for
much.
the tube, we can have a review of the image for the tube, and we see the normal tube. Yeah, so this is the X-ray test for the tube. They appeared here, the tubes, the normal tubes, and spill out like how I said before, and the womb cavity also is seen here. We can have a look at the blocked tube. Yes, so again for the blocked tube, you will see the cavity of the womb is seen. The tube appears but stops somewhere here and stops somewhere here. That indicates the blockages.
Okay.
Yes, so this is how it is done. These are simple tests and they're not very expensive.
Okay.
Yep.
Thank you.
Yep.
Thank you so much, Doctor. Please have a seat.
Yes, so
we are going to have a very short break, and when we return, please feel free to share with us your views, give us your comments, and give us all your questions on 0786 050 762. And Dr. Annabert will be here to give you all the answers that you're needing.
Bethany TV for health. Ladies and gentlemen, we are thrilled to introduce Bethany Santa Omugabi, who will be sharing wonderful goodies with you this Christmas season. Getting a chance to meet Bethany Santa Omugabi is easy. Just tune into Bethany TV and get to know our various programs and talented presenters. Bethany Santa Omugabi will make surprise appearances during our live programs and offer Christmas hampers filled with an assortment of goodies, including healthy food items. When you spot Bethany Santa Omugabi during any of our programs, be the first to call in and say, "Hello, Bethany Santa Omugabi. I am your Christmas date." He will then ask you a simple question about our programs and presenters. If you answer correctly, you instantly win a mega Christmas hamper. But that's not all. You can also respond on social media. The first 20 people to respond to each question on social media will be entered into a draw. And lucky winners will be picked and announced during Bethany Santa Live on Saturdays. Bethany Santa Omugabi, only on Bethany TV for health.
I thank you for my life.
Ladies and gentlemen, the Nsima Festival has returned. On the 17th of December 2023 at the National Theatre parking lot. Doors open at exactly 10 a.m. with bouncing castles for children, games, performances headlined by Jean-Marie, alongside all your favorite gospel artists. Tickets available at only 10K for kids, 20K for adults, 50K VIP, and 1 million for a table. The Nsima Festival is proudly brought to you by Bethany TV for health. Introducing Bethany TV, the pioneer health and wellness channel in Uganda and Africa, having a profound commitment to health and wellness. Our content takes various forms, from music and series to documentaries, talk shows, news, features, movies, cartoons, and reality shows. We are a hybrid station available on free-to-air and pay platforms, embracing the digital age as we maintain a strong online presence through our website, social media platforms, and mobile apps. Explore our rich and diverse content, engage with us on social media, and be a part of the positive change we aim to bring to the health and wellness landscape. Bethany TV for health. Bethany TV for health.
Welcome back from that break. This is still Bethany TV and it's Medical Mind. This is Teacher Zita together with Dr. Anna Bat on the show, and we're looking at infertility. Wherever you're watching from, please keep checking on and following our programs, because Beth and Santa will come in anytime, ask you any question about the shows, about the programs running, and if you get the answers correct, you win a Christmas hamper for yourself. This is Bethany TV. Welcome back to the show. It's still infertility, and Doctor was still telling us more that we need to know about this very particular topic. Doctor, we have gone through all the illustrations. Now we want to look at the treatment. Are there possible treatments of especially one blocked tube? Let's start from there.
Yes, there are treatments. There are treatments for most of these causes of infertility.
Okay.
For the blocked tubes, it depends on the extent of the blockage.
Okay.
Some of the blockages are mild and minor. You don't have to do anything about the tube. Sometimes you advise the people to either time, or you give them some medication to increase the number of eggs to overcome the scarcity of the inability of the tube to move the eggs. So if you provide for it more eggs by stimulation, you'll be able to overcome.
Okay.
Now, in some of the cases, you have to correct the tube. You have to work on it to make it go back to the normal functioning state.
How do you do that? Through surgery?
Yeah, most times it would require some surgical intervention. Some of it may be minor, some of it may be major, depending on the problem. Currently, the recommended approach is, depending on where the blockage is, the recommended approach is to use hysteroscopy. Well, this is a procedure which is done, some camera and the gadget is put through the cervix and you go into the womb.
Or you're able to see whatever that is
yes,
inside.
So for the blockages which are right inside the womb, you're able to unblock from inside.
Okay.
And also you could use laparoscopy, which in this case approaches through the abdomen inside. So those are procedures which are done in the theater.
Okay.
They are invasive, but not as invasive as the usual opening technique. Yeah, okay. So you do that. At some stage earlier on, before these laparoscopies and hysteroscopies became available,
okay.
we used to flash. They would do flashing of the tube.
Okay.
So the doctor would use some medication mixed with some fluid and push inside.
Okay.
And then with the hope of unblocking the tubes.
Okay.
Yeah, that's what we used to do. But now we don't do that much.
Okay.
So we now go for either hysteroscopy or laparoscopy. Yeah, if it is a blockage of tube and you want to unblock.
Okay.
But some cases are so severe that you don't need to unblock them. You have to go on and do IVF. Which means instead of the sperm and the egg meeting inside the tube in the woman's body, you get them out. You get the egg out and you get the sperm out, and you make them to meet in the lab, in the specialized lab of the IVF.
Okay. Thank you, Doctor. I have a question for you, but before I ask it, there is someone who sent you here a message. He's saying, "Hi, Doctor. My 9-year-old son has small balls." I think those are testicles.
Yes.
And a very short, I think, male part. Is this a problem as far as his reproductive life is concerned? He's tall and big and looks older than his age. Will his private the private part of
will it improve?
Yes. Will it grow proportionate to his body? I think she is, where is the name here? Grace. I think she's Grace from Makinde. And then secondly, she's saying, about myself, I'm 47 years old and still receive my periods normally. Those are 6 days. But I get these hot flashes that I call symptoms of menopause. Am I wrong to assume so? I'd like to conceive once more, but had my tubes surgically surgically blocked when I had my 4th child in 2014. Is it wise for me to have my tubes unblocked at my age?
Yeah, Grace, thank you very much for those questions.
Yes.
Yeah, starting with
the little boy.
The little boy,
yes,
who has small size testicles. which is calling balls, and also I think he's describing that the penis is also small.
Very small. And
it's very small. Now, sometimes the causes of fertility issues are congenital. The person is born with it, and they may manifest in either delay in women, like for example, to get into puberty. Of course, in my mind, also a boy can also have a delay to get into puberty, but also it can show as the genital structures being not developing well. Well, I'm not saying that the child has those issues, but this is a child who needs examination by the health worker.
Yes.
Both the genital examination, looking at the balls and the scrotum and the penis, have to be examined, and other features of some abnormalities have to be examined, because we do have some genetic issues which affect the development of the child as a whole, and also development of their reproductive system in specific. So
thank you.
Yeah.
And then her concern about to unblock her tubes.
She wants to unblock her tube. I think again she needs to be re-evaluated so that the management plan is drawn by especially a fertility specialist. She has to sit down with a fertility specialist so that they are able to draw a plan and to give her advice on what the best approach is.
I will.
Well, at 46, it's a good sign that she's getting a period. It could be that she may still be having some reserve of eggs, but whether it is logical to unblock her tube and to allow her conceive normally, or she uses some other approach, for example, IVF, has to be discussed with the doctor, because in that age range we have the risk of chromosomal or gene issues, and IVF probably will be a better option in that case, because then during IVF you can first check the genes of the embryos before you transfer. So that discussion has to be done with her doctor.
Okay.
Yeah, before she just rushes to try and unblock her tubes.
On her decision.
Yes.
Thank you.
Yep.
She's also saying, what would you advise as far as surrogacy is concerned? Please don't advise on best way forward. I need a child now. She's also thinking of surrogacy.
Yes. So yes, actually, just to explain, surrogacy is a form of fertility treatment.
Doctor, for those who don't know what surrogacy is, what is it?
That's what I'm explaining now.
Mm.
Surrogacy is a form of fertility treatment where another person, another woman, carries the pregnancy. Now, the basic IVF treatment involves the doctor getting out your egg and getting your husband's sperm. One day we'll talk this in details here, but get out the sperm, get the eggs, get the sperm out, and these two are made to meet in the specialized IVF lab. And then from that you actually get what we call embryos. These are real babies, and then they are put in the womb, and they can
the
grow.
Womb of the woman?
Of the woman.
Of the mother?
Yes, of the mother.
Okay.
Now in surrogacy, instead of putting the embryo in the womb of the mother, for some reason we will explain, we put it now in another woman to carry.
Is it done here in Uganda?
Of course, we do it, and it's not a complicated science. We do it. We have been doing it for quite some time now.
Really?
Yes. So when we do that, we are doing surrogacy. Now there has to be reason. There has to be reason as to why the original biological mother cannot carry her baby. There has to be reason. So we have to evaluate, are you having health issues? Is your womb okay, or it has issues? And so if we judge for this reason that you can't carry the pregnancy, and then somebody can carry for you. So it's possible to do that, but it has to be assessed.
First by the medics?
Yes.
Okay.
Yep.
Thank you so much for the responses. Grace, wherever you are, I think the doctor has given you back your feedback. Please, before you do or decide anything, seek for medical help from a specialized personnel, so they can make for your timetable, plan for you, assess you, and they see whether what you want to do is possible. And then for the little child, the doctor has been so clear. I think it could be genetical, or is still growing, or still you can go to the clinics or to the hospital, or you can visit Bethany Hospital itself. It will give you a better answer to that. She's saying, thanks Teacher Zita for the show. What causes sperms not to have tails and how can it be prevented, doctor?
Yes, so the report, as we said, analysis of the sperm is usually a detailed analysis which involves counting the density of the sperms, the population of the sperms, but also studying their shape, including the different parts, the size, the shape of the head, the presence, absence of the tail, the shape of the tail, yes, and their movement as well. Now, problems of the sperm, especially structure, like the one she's describing is absence of the tails, is a structural problem. Now, these problems usually arise from the development process of the sperm. And the development of the sperm goes through extensive stages, several stages. We describe a number of them now, but at some stage, the sperm has to develop the tail. If that stage is interfered with, either because of some diseases or because of some enzyme issues, somebody is born up without the certain enzymes, then the sperms will not be able to form the tail. And we know at what stage we say sperm formation is being arrested. Yeah, or sometimes if the sperm from the process is released before it develops the tail. So these are technical issues with sperm development. Yes, so structural issues with the sperm usually reflect abnormalities resulting from the formation process.
Okay.
Yeah.
Thank you so much.
But it needs, if you have a few sperms without tails, that may not matter.
Okay.
It needs to be more than 40% of the sperm without tail. That's when you become of concern.
Okay.
Yep.
Thank you so much. We have another message coming in. I was inquiring at what age or months can a baby be operated in case of undescended testicle? Thank you. This is a parent, I think, inquiring.
Yes.
Though she didn't give us our name. Just in case you're giving us a feedback or inquiring, please tell us where you're calling from or where you're sending your messages from. For those of you who could have missed the number, it is 0786 050 762, and then we shall be able to get all your feedback. We have many messages coming in, but let's first answer that maybe.
Yep.
Yes, he wants undescended testicle. Can it be operated and at what age?
Yes, so undescended testicle should be operated as soon as possible. It must be moved down into the scrotum as soon as it is noticed. But there are those few cases where it's as a result of delay in the movement, which is a normal delay in the movement. So because of that, they move by themselves after a few months. So within about 2-3 months, you should be able to see the testicles appearing. So we usually recommend that within 3 to 6 months, we should be able to do that operation.
Okay.
Yeah.
Thank you so much. I think you've got the feedback. Calls are also open. You can call on 0786 050 762. It's still Medical Minds. Doctor, another question here from Jackie. She's saying, I have all my tubes blocked, doctor. Which medical solutions do you give me? Yeah, blocked tubes, both tubes blocked. As I described before, we have to assess where the position blockage is and what extent the blockage is. Sometimes we can correct them, but sometimes we don't have to correct them. We do IVF. Okay.
And of course, we also have to consider other factors because if somebody is very young, maybe he's about 25, 30 years, and the blockage is not too much, then you have more reason to do the unblocking.
Okay.
But if somebody is maybe 35 and beyond, and there is some blockage. Now you see, you'll need more time for them to try after unblocking. So it becomes more logical to be more radical, and you go for things like IVF.
Thank you.
Yes.
Jackie, I'm sure you've got your feedback from doctor.
So again, what I can say is that this discussion has to be face-to-face with the doctor. Yeah, a fertility specialist has to guide you on what the way forward is.
Okay.
Yes.
Thank you so much. Our next gentleman is saying, Kawoya from Nansana. I'm stuck. I've been trying to conceive with my wife for a year, but not married yet. But I don't see any change, and I think we might be having a problem. I've been treating, is it cystitis?
Cystitis.
I think
cystitis. That's a bladder infection.
Oh, maybe the way he has written it. The doctor says that. The doctors say, but I didn't see any change in me. While I have any hope
Will I have any hope?
Will I have any hope? I think maybe that's what he meant. Yes.
Yeah. So,
doctor, before you respond, there is a call online. Caller, hello, Bethan TV.
Hello.
Hello, caller. Where are you calling from? Kale mama, nawe je baliko. Iye mama, iye mama. Ani akube essimu tubulireko ku mannya go. Bitura? Yes, iye mama.
Sumaya.
Oluganda lwogere tujja dutegeera mpola mpola.
Kakati nina muzukulu wakatugire ku nsonga kaka muzukulu wange wange yali amakumi n'esatu mulezi.
Okay.
Yazaalibwa lunomo nga okatwe kayimirira n'ebekyo nagenda okulaba tuuse emyaka nga 7-8 awo nekagwamu amaanyi nekayimirira nga bukagwa kayimirira naye nga kikatayimirira ate n'ensula ze zakenera kutono nnyo.
Okay.
Kakati awo
Kale nyabo. Naye tweyanziza nnyo omusawo kakuddemu. She's saying she has a 12-year-old grandchild.
Yes.
I think the testicles are maybe, I think they're shrinked, something like that.
Yeah.
They started when I think the child was 7 to 8 years. But for now, sometimes, it is very normal for a male child to wake up in the morning. To erect when they wake up in the morning, especially morning time, but this child does not erect at all. What could be the problem? Is there any hope for that child?
Yeah, so of course that is a concern. 12-year-old is a little bit young for you to conclude about the erection behavior.
Because she's saying it started 7 to 8 years when he was around that time.
Yeah,
age.
so for the evaluation of the erectile function, I think she really needs, that child needs the doctor to assess. Again, also for the testicles, if they are small and they are shrinking, these are some of the cases of where somebody had maybe mumps before. And so maybe there could be still an opportunity to rescue her or him, and to rescue him. And so I think this needs a proper assessment and a more urgent one.
Okay.
Yeah, we have to. She has to take that child to the hospital for evaluation.
Thank you.
Could be the nearest hospital and find a doctor to examine the child properly.
Okay.
So that this is sorted out as soon as possible.
Thank you so much.
Yeah.
Kakati mama yonna gy'oli omusawo agambye osobola okufuna obudde n'ogenda mu ddwaliro n'olaba omusawo omwana ono ne bamukebera asobola okufuna obujjanjabi as soon as possible ku myaka gye gy'aliko. Ayinza okuba yalwala amambulira nga muto oba yafuna ekizibu nga temwakirabirawo, naye akyalina essuubi nti nno omwana we tukyasobola omuyamba oba basobola omuyamba mu ddwaliro. Weebale nnyo okukuba essimu. Doctor, we have other questions before we went to respond to the calls. We had a message from viewers. He's saying, "Hello, Dr. Underbat. Thanks so much for the show. It is good to. Is it good to do SHG? Is it HSG the second time after 2 years if the first one showed one blocked tube? Can there be changes in the blocked tube over time? Can the radiation affect me because I did the test already?" This is Chisache.
Yeah, okay. Yes, that's a good. Those are good questions. Yeah. So if you did HSG 2 years back and up to now you haven't conceived, it's okay to repeat and see. If the doctor so requires that you repeat it, because even without treatment, sometimes the situation could get better, because the body, as you know, from any illness, the body tries to recover itself, and this same thing can happen for the tube. Even if they were badly blocked, even if they were both blocked, they can unblock themselves. So it's a good idea. 2 years is a long time. Things could have changed. So if the doctor saw things that they need to reevaluate your tubes, it's okay. In terms of the safety, yeah, it is fine. That brief exposure to the radiation is not a big problem, because also the current X-rays, they have low levels of radiation, so it's well monitored, and you wouldn't be able to have an issue. Really, I can confidently say you will not be able to have any issues there.
Thank you.
Yep.
She's as well asking for the address of Bethany Clinic. Wherever you're from, Chisache, you can go to Luzira. There is Bethany Hospital there, and then also Entebbe Road. Shortly, around Chitubulu, before you cross the traffic lights, you'll see Bethany on the left-hand side, and then you get any medical help that you want. Doctor, did we respond to Kawoya from Nansana?
Yeah, maybe, I think
this
we didn't.
Gentleman, I think a call came in.
Oh yeah, it was interrupted by the call. I think we can review the question.
He's saying he's stuck, they've been trying to conceive, but all in vain. I think he has been treating, is it cystitis something?
Cystitis, okay.
Cystitis, yes, the way he wrote it.
Yeah, so cystitis, he's referring to infection of the bladder. Now, yes, Mr. Kawoya, you say you've been trying for 1 year with your wife, and I think you are trying actively and nothing is happening. Definitely that is a call for concern. It's very rare that blood infections will be severe enough to cause for you issues with your fertility. So you need a proper systematized assessment of you and your partner. Full evaluation. On your side, you need your sperms to be evaluated. Again, of course, in the hospital. Yes, you need your wife to test her tubes. Of course, it's still in the hospital, and the womb has to be evaluated, and if possible, also her hormones. So these things have to be done, and the 4 questions of how the sperms are, how the eggs are, how the tubes are, and the womb, how it is.
So they should do it collectively as a couple.
To have, yes, they have to go together. They see the doctor does the story, and then does the tests.
Thank you so much. We have quite a number of callers and messages coming in, Doctor, though we are running short of time. Caller, hello, Bethan TV. Hello, caller.
Hello, good evening.
Good evening to you, dear. How are you?
Hello.
Hello, we can hear you. Where are you calling from?
Yes, this is Stella from Banda.
Yes, Stella. Thanks for calling.
Yeah. I have 2 baby boys.
Okay.
And when they are urinating, they can cry a lot, and their pain is reducing the size when they are urinating.
Okay. Thank you so much, Stella, for the concern. Thank you so much. Yes, doctor is going to respond to you immediately. Stella is calling from Banda, and she's saying she has 2 boys, and every time they are passing out urine, they cry a lot, and their male part seems to be decreasing in size. What could it be?
Yeah, Stella, thanks for sharing your concern about your boys. Pain on passing urine is called dysuria, is of concern. That most likely means either there's some infection in the bladder, or something is blocking the passage, the easy passage of the urine through the passage. So that needs to be evaluated. If these boys are young, some conditions, some boys are born with it, and either the urethra is narrowed, or that may be associated with opening of the urethra on a wrong side, and the opening is narrowed. Okay. So this is something which has to be evaluated. First, if they are young, by a pediatrician, and if the pediatrician thinks that he or she needs the consultation of a urologist. Urologists are doctors who are specialized in the urinary system, and they can give some further assistance.
Thank you so much, Dr. Stella. I think you've got a response. Please try as much as possible to see a medical specialist. We have another caller.
Especially a pediatrician to start
Especially
with.
a ped. Thank you. Caller, hello.
Hello?
Yes, who is calling? Where are you calling from?
This is John Bosco from Gaba.
John Bosco, nice hearing from you.
Yeah.
Yes, please.
I want to thank you for this program.
You're welcome.
For me, I have some certain things here, difficulties here in my body.
Okay.
So I don't know if people can help me with it.
Please feel free to ask your question.
My testicle, They are started 2020 actually. Now, up to now, I went to see a medical doctor. Then they told me that that is UTI.
Okay.
So I've been taking some medication. It said for 2 years.
Okay.
So the thing has started again.
Just started
So
pain
they've
again.
given me the Vaccine, Metro, and I forgot the names of the other medicine.
Okay.
Yeah. And that thing, it's very difficult for me to stay with my wife on that bed.
Thank you so much, John Bosco, for your concern. Doctor has got you
Thank you
clearly
so much.
and is going to give you feedback. Wow, doctor, a lot of issues.
Yes, so he's raising his concern there is that he's having pain in her testicles, in his testicles, and this seems to be recurrent, and I think they are trying to give him antibiotics for the treatment. Well, if you get pain in your testicles and it's from infection, we call that otitis. If it recurs, it's usually advisable for you to see a urologist. Now, it's urologists are specialized in assessing that urinary and genital system in this case, because they will help to evaluate. Sometimes they do extra tests. Instead of doing antibiotics all the time, I think I would advise you to see a urologist. Urologists, they are available in the country. We have, even here in Kampala, we have quite a number of doctors, urologists who are available, and they should be able to assess and give an opinion on how best this can be done. Sometimes what happens is when you get an infection, you get the channels narrowed, and now you get scarring, and that increases your risk of getting subsequent infection. And so, but that is best evaluated by the doctor.
By medic.
By the medic,
Thank you so
especially
much.
the urologist.
Okay.
I think for you now, you need to see a urologist. That will be the best option.
Thank you so much, doctor. I think John Bosco, doctor has responded to you well, and please take the advice that he has given you. Another question is coming in here. Doctor, we have very many questions. Someone is asking for the cost of an IVF. Please, Grace, in Makindia. Thank you so much for your concern. I think you can come to the hospital. Yes, you get all those details from the hospital. Thank you so much. Is this one of our followers saying, Fatuma in Kawempe, what causes pain on the right lower part of the abdomen?
Right lower part.
Yes, consistent pain.
Yeah, so, well, yes. So if you have pain in the right lower abdomen, the common organs, for example, in the lady there are the ovaries, the right ovary especially. You have the right tube, but also the appendix is located in the same place. So if you have recurrent pain, those three have to be evaluated. And so a doctor will be able to examine you, will be able to request for a scan. When the scan is done, if it is a pain coming from the ovary, maybe because of a cyst, the cyst will appear on the scan.
Okay.
If it's a tube blockage or a tube having water in it with infection, the scan will also show.
Okay.
But if it's appendix, clinical exam and also a scan can be able to show. So you need an urgent. Some of these conditions are life-threatening. For example, appendicitis. If you have pain because of appendix infection or appendix blockage, then you need urgent treatment. So I think you need to be examined. You can either be examined by a gynecologist or you can see a surgeon. But I will recommend a gynecologist to start.
Thank you so much.
Yes.
Doctor, we still have a lot of questions, but we are time up. We are time bad.
Time is
and I
over.
request that next time, as we start the show next week, you first answer these questions that have been sent forward. But because of time, there are over 5, 6. There are over 5, 6, but we already time. Our time is used up. There are actually very many. I would request that doctor starts by answering our question next Sunday as we start the next show next Sunday. We are very sorry, we are time bad. At least my major concern was how to treat infertility.
Yes.
Blocked wombs, which we've talked about, low sperm counts, which we've talked about, and then also the lifestyle. Doctors advised us, especially the youth, the gentlemen, look at the lifestyle you're leading. And then the mothers also, please, moms is a life-threatening kind of factor in a child. The doctors talked about it. Doctor, please give us your last word for all those who have been watching and listening with infertility problems.
Yeah. Yes. Well, I can advise people that first of all, thank you for listening, because knowledge is power.
True.
Yes, and my take is that infertility should really not be taken as a death sentence, because we have solution now. And these solutions are available. As we keep on going through this series, you'll get to understand that these things are possible, and we are doing them already in this country. Okay. So you should not kill yourselves. Don't separate because of infertility. Please, these things are treatable. Yes.
Thank you so much for being with us. This has been Medical Minds on Bethany TV with me, Teacher Zita, and Dr. Underbat. From the team, please stay well. Have a very good night.